If your family is in a situation where you're pregnant, you're going to be looking for a place to deliver, you may want to pay special attention to this interview with Nancy Hengelfelt out here in York, Nebraska. She heads up the OB department for York General Hospital. And again, I'm going to tell you, if you want to talk to people who want to make a difference, that's their core commitment, you're going to find this interview very interesting. Thanks for watching WowBizTV. Thanks for joining me here.
You're welcome.
You know, Nancy, I find this idea, you've been here at this OB department. It's a very special thing. I mean, bringing babies into the world. Very meaningful. And you've been here how long?
I've been here for 38 years. And I've had experience in the OB department that entire 38 years.
Oh, my goodness. Do you think you've accrued a little bit of wisdom about babies and the origin of life during that period of time?
I hope so.
Oh, my goodness. And I heard your daughter works on your staff with you?
Yes. We needed some extra help in our OB department, and
Say, I got somebody at home I can bring in?
I did. She actually moved back to Stromsburg, where I live, and she works in the OB department with me.
I bet that's got, if she were here right now, I bet she would just say it's a thrill to be with my mother in this situation.
I hope so. It's really a great experience, and I love working with her. I love working with all of my OB staff.
Absolutely, and you get to do such important things. We're going to return to that in a second. But, you know, that compassion and that sense of, nurturing, I guess you could say. Tell me how that manifests itself in your check-in procedures and all that, okay?
Okay. When an OB, a labor patient, is admitted, we assign one nurse to take care of that patient.
One nurse?
Right. So,
Now, is that a little bit different than standard procedures? I mean, other places like shifts, you know, people come and go and all that,
Yeah.
but assigning one person, that would seem to be...
It's great because it allows the nurse and the mother, her husband, the entire family really to develop a relationship.
It's like a little team, isn't it? Kind of a SWAT team.
It's a little family is what it is.
Because we're all going to go through something together here.
Right.
Yeah, I think that's amazing. What about the, you're part of a fairly sophisticated healthcare system out here.
Mm-hmm.
I think a lot of people are impressed with the complexity and the sophistication of it. And I know they invest in technology. Tell me a little bit how technology can shape and enhance the whole OB process a little bit. I know I was impressed with that.
Okay. Well, one of the things that we have fetal monitors in each of our labor rooms.
You know, fetal monitors. I think I've seen those on TV. Tell me what that means, really.
An electronic fetal monitor is applied, and it monitors mom's contractions.
Okay.
It also monitors the baby's heart rate.
All right.
We can determine fetal well-being by watching the monitor.
That's amazing. So you know how the mom's doing and you know how the baby's doing based on, I don't know, the different graphs and the colors on the little chart and all that kind of stuff, right? Like I said, I've seen it on TV.
Okay, all right.
But it's very emotional when you're right there.
It
You're
is.
watching it carefully and so on, right?
Right. And we're very lucky here. We have 2 portable fetal monitors, and that allows mom to get up and move around. It's just great.
You know, is that new? Because I don't think of mothers walking around at this stage in the process down to the last, around the 5-yard line,
Right.
walking around. Is that a good thing or a bad thing?
It is a good thing.
Why?
Well, we use it when we're doing Pitocin inductions. Pitocin is a medication that we use to stimulate contractions.
Okay.
It's considered a high-risk medication, no matter where it's used.
Okay, thank you for saying that. So it's not something that you do with everybody. You don't use Pitocin with everybody.
No, we just use it if it's time for the pregnancy to end, if it's time for the baby to be born.
We've got to move forward here.
Right.
Well,
right.
I got to ask you this question. What percentage in general now do you have to use Pitocin or kind of, induce a little bit? 10 or 20% or more?
Probably maybe around 30%.
Around 30%? Okay. I just was curious about that.
And it's for different reasons. Sometimes it's patient choice. Other times it's the need for the baby to be born.
Yeah.
It's a medical.
For all those reasons. And I know that's a complex decision to make. That's not something that somebody says, all right, well, let's just get on with this.
Right.
Absolutely. Well, tell me a little bit more about the staff. I know that you're a heartfelt, straightforward person. Everybody in New York here seems to have a special, sense of compassion or sensitivity, maybe is a better word, more professional word for the patient. But tell me, how do you find and cultivate and recruit people for your staff? Because that's a big thing. I mean, and obviously your viewpoint is kind of shaped the culture of the department. and the staff's attitude towards people. Tell me about that.
Okay, well, I think it takes a special person to want to be one-on-one with the patient for 12, 16 hours.
Yeah.
But, and they have to like being able to coach. I just recently had a new nurse, and she came in and watched one delivery, and she came
Yes.
to me afterwards and said, I really want to work in your department.
Wow.
And I said, that would be great. I think you'd be very good at
What
that.
an easy recruiting process.
It
You
is.
Just sit
It
here
is.
and watch it and then tell me what you think, right?
Yeah.
So can you sense intuitively the quality inside of people that will help them be really great, or is it a kind of a linear analysis that we have to check boxes on?
No, I think they have to have the personality. They have to be compassionate, caring. They have
Others-oriented, kind of focused on other people.
Right.
Yeah.
On putting them first in their day.
Yeah.
And then I think they really have to want to make a difference.
Now tell me about that. I mean, it would be profound to me. I would be so emotional every day with all these babies being born around me. When you say make a difference, what are you really referring to? Bring somebody into the world with that intimate moment with the family? Is that kind of what you're talking about?
It is. It's something that you get to share. It's a privilege.
Well, Nancy Hengelfelt, I feel like I know what's going on inside of your OB department right here at York General. I really enjoy and appreciate you allowing me to kind of step inside of your very important world. Thank you so much, and thank you so much for watching us here on WowBizTV here in York, Nebraska. I'm Lynn Hinderrocker, and we will see you next time.